Okay, very good morning to everyone.
Good morning.
Good morning.
Good morning. Okay, I think new people will think why I'm talking about morning. So we always fresh. Moshe, is Israel morning
Yes.
now?
What the time is? Because it's very difficult to hear you. It's about
Okay.
3:10 afternoon.
Afternoon. Okay. So means that some other country are still morning. So DXN is everywhere. Okay, so before we start, there's quite a list of questions. I will go through a quick questions on this and answer it. Then after that, we can discuss about the cancer and some part of the stroke. Okay, the first questions that Frankie already listed down and sent me. He said, what is the prescription for the headache? Okay. So before we know what is the prescription of the headache, you need to know why you got headache. Okay. So to get the headache, you got so many reasons. If you don't sleep properly, the moment you wake up, you will have a headache. Okay. If you don't have enough, sleep, if you don't have enough rest, okay, if you're always tired, sometimes the blood circulation to the brain is slow. When the blood circulation to the brain is low, then headache will start to come. So how to counter it? So most of the time people will counter it with what? With Panadol. The easiest dosage they can put it. So how Panadol can help? Actually, it never help. It just make your system blocked with the resist the pain. It helped to resist the pain and release the it will release all the enzyme, the water enzyme in the body. So you will get sweat after you take the Panadol. But that is not good for long term. Okay, the best is you can take Androgy. Okay, you can take Roselle. So when you have a headache, you just put 1 or 2 tablets Roselle on your mouth. Just suck it slowly. So you can feel the headache slowly will disappear. Why? Because Roselle has enzymes that can balance your blood system. Okay, you can use GL, you can use Roselle, you can use Androgy. These 3 things will help you to counter your headaches immediately. Okay, so second one, what is the prescription for gout? Okay, when you see gout, arthritis and rheumatoid arthritis, these are the 3 things, like we call it brother and sister. When first time the people can kena gout, when they attack with gout, means that the acidity start to penetrate the muscles. When the acidity start to penetrate and rusting the muscle, we're using the rusting word lah. Normally iron will be rust. So easy for you to understand. We're using a simple word make you understand. If your muscle that moved get rust, you will get gout. When this muscle, when the rusting start to attack the nerve system, okay, so you will have the muscle and nerve system together, you will have arthritis ready. Okay, when the muscle, nerve and the bone system are getting rusted together, all these 3 things are connected together, it becomes rheumatoid arthritis. This is the moment it becomes swollen and the movement all been cannot move. The movement will locked. So your finger all been locked and swollen. So it become more worse. Then you cannot move your finger, you cannot move your leg. Every joints become rusted together with the muscle, nerve and the bone together. So this is the 3rd level. So when you get the first level of gout, means that your uric acid is high. Okay, a lot of people keep on telling that when you go hospital, they say don't eat this, don't eat that, don't eat nuts, don't eat peanuts, don't eat seafood, don't eat so many things. They will give you the list when you have a acidity issue or uric acid issue or arthritis gout issue. Then you end up with stopping eating everything. In reality, nothing to be worried about the food. The reality is actually you never digest it properly. You never munch it properly. Let's say you take a bunch of peanuts. Okay. So mostly hospitals said what? When you have a uric acid, don't eat nuts. You can eat nuts by munching it properly, make it powder and make it mix with the saliva. Then the acidity will be reduced and saliva enzymes will alkaline your system in your stomach. Okay. The problem with the nuts is what? Whenever you start to eat peanuts, you will munch it 1 or 2 times only. Then the full peanuts will break into 2 or 3 pieces, enter your stomach. Then you eat a bunch. Then your stomach full with the peanuts that not break into pieces and parcels, powderized, not digested. So now you don't use your teeth to munch it properly. Then it enters the stomach. Stomach won't send it to small intestine. So this is the scenario that small intestine that don't have teeth. Okay, the teeth actually in the upper, on the top, on the mouth, and your stomach don't have grinder to grind the things for you. So it has to use high acid hydrochloric to melt it, to digest all the peanuts into powder. Okay, then only it can send to your small intestine. Otherwise, if it push to everything into your small intestine, your small intestine will stuck. Think about you put something particles into your sink, it will be locked, then the water will go up. So you need to clean it up, then the water can flow through. Same thing in your stomach and small intestine. So indirectly, when you eat this kind of food, you are increasing the acidity factor to digest the food. So your acid hydrochloric is a pH 2. So when you start to use too much of acid hydrochloric, it end up to penetrate your body. When it go to small intestine, it will go into your bloodstream and go all over your body. End up, it will stay around all over the place, little bit by little bit, it will be clogged and become a toxic, high level toxic, and end up in arthritis. Uric acid will go up first, arthritis, gout, rheumatoid arthritis, and some other things also. Okay, that's why actually gout is formed. So how to encounter it? We can use, we can reduce the taking all these kinds of acidic poor food, or if you like to eat, munch it properly and make it powder before it enter the small intestine. Then stomach no need too much of acid to digest it. Okay, then indirectly you are reducing the acid level in the stomach. Okay, so how to counter it? The gout, you can use codipine, you can use morinzyme. You need the enzymes more. Acidity, you need to play with enzymes. See, a lot of people complain that codipine is acidity. Yes, it's slightly acidity, but the acid in codipine are actually a good acid. We need the acid, certain factors like malic acid, amino acid, some other acid that really help the body, not the acid that kill the body. Okay, so you need certain acid to balance the body, and also certain to neutralize the acid, you need to acid. You see, it's like that. It's like what you want to cut the diamond, you must use the diamond. Okay, you cannot use anything else. So to cut the acid, you need acid. To cut the alkaline, you need a good alkaline. So this is how body works. So when you do this, it clean up your acidity in the body and detoxify it, and slowly it reduce it. Then you can see the circulation is better. Then slowly the acid will come out from the toxic acid will come out through your toilet or urination, everything. Most of the acid are in the water formation, so you use urine to flush it out. This is how uric acid you want to reduce. You can use spirulina, you can take RGGL, Raji to remove all the acid out, GL to balance the cell that affected, and you can take black cumin also. These are the basic things you can give. Okay. So the third question, what prescription for period pain? Okay, period pain is the normal pain that normally ladies will have. Okay, so they got few type of pain. Okay, that's why when the pain came, we have to see which are the angles the pain are. So our abdominal, they call it 6 pack. So we need to see which are the pack has been affected and the pain is higher. Okay, if it really the pain is not in the back but in the middle of the navel point, that is the real they call it a period pain. But to reduce that, why the pain is coming in? Because the blood circulation towards that area is less. So the body don't have enough blood to circulate over and to balance and to supply oxygen and nutrition to that area to balance it back. Because you must know, when the period cycle coming in, your overall uterus are breaking down, then you call it, that is a wound. Okay, that is a wound. Okay, it's a like open wound because it's breaking. When it break, it's an open wound. So when it open wound, you need to recover it with nutrition and natures, with blood supply to that area. So to supply that, you can use morinzyme and GL powder. So you can give the ladies have period pain, you can give little bit, you take 500 ml of water, you can add in 1 or 2 scoop of GL powder, you can add in a little bit of morinzyme, fruitzyme, shake it and give a drink. This will enhance the circulation. And also you can take little bit of our toothpaste or Gano oil, apply to the abdominal area. So when they do that, the pain will be eased out. Okay, will be eased out. So when you keep on doing that, so you in the longer run, the pain totally will disappear. You won't have the bigger pain. If you have a very good circulation in throughout that area, then you no need to worry at all. Okay, so we go to the next question. What prescription for acute arthritis? Same thing. The question number 2 is the same thing. Arthritis, gout, arthritis, and all these things are same. You can maintain the codipine, for morinzyme, fruitzyme, spirulina, black cumin, RGGL. Same thing. Okay, no need to differences. Okay, number 5. What prescription for panic attack or depression or orang gila? Okay. This is actually a big situation, scenarios. Okay, when you see the big scenarios, like people get panic attack is different, depression is different, orang gila is totally different. Okay, so these 3 things are totally different things. It's not the same. Panic attack is actually your mind has been attacked. Fear. Okay, so when you take the depression, it's differentiate into 3 categories. One is anger, another thing is actually anxiety. First is anger, second is anxiety, third is fear. Okay, when people are fear, then only panic attack will coming in. Suddenly they got a heart pain, they become fear, they don't know what to do. Panic attack is the brain don't know what to do. Okay, you will become panic. You don't know what to do. What is the result? Somebody accident in the road, suddenly you go and see them, you panic, you don't know what to do. That is called panic attack. Means that the brain not functioning. So this case, you must relax. So you must cool down your mind, relax, sit down for a while. Let's say you got this attack, you fear. Okay, something's happened, you are attacked. Okay, you have the fear. Sit down for a while, close your eye, count 10 to 0. When you count 10 to 0, you will get the solution. Then you will act accordingly. Okay. Depression also same thing. People got depression also due to too much of food. Also acidic food also will get more depression. Okay. So that's why you can see eating too much also is not very good. Eat in a correct amount is very good. Eat on time, not too much. When you eat too much, actually it's a depression. No? People who in a depression, orang gila, all these things they keep on eating. They're eating too much. So depression, anxiety, fears. So these are things. And orang gila totally different lah. Orang gila is totally the brain already disorder. Okay, it's not his problem, but the brain is cannot functional anymore. They don't have any emotional or the emotional all these things is like bipolar. It's no more bipolar. It's like triple polar already or fourth polar already. So they will keep on changing all the scenario of characteristic, keep on changing. Sometimes they were very high, sometimes they're very low in the characteristic. So very hard. So that's why they normally give a sleeping pill, make them sleep. There's no treatment for them, but in the early stages, we can balance them by communications. Okay. Most of the people who are in panic attack, okay, who are in anxiety, who are in depression or at the end become gila. At the end become gila. The first problem of them is people, they don't have a communication with the family members. Okay, when somebody start to isolate them from somebody, they will go through these kind of things. Means that these people need more communication. Okay, when you keep on communication, when you keep on talk to the person, we already have a gathering. So this person don't feel they are isolated. When this person feel that they are isolated, they are in the first category of depression. All the panic attack, everything will come out. Okay, so that is the problem of these people. That's why when certain time, when people getting older and older, a lot of people try to isolate themselves, or they have been isolated. This is the biggest issue currently. Okay, and same thing happened to the children's nowadays, teenage children's. The problems happen, isolation happened between father and mother with the children. So this is also not good. The isolation started, then this become panic, and they all try to do themselves. They'll go out from the house, they will go and find the house, they will try the communication. They try to find the communication, where they can get the communication. If the communication is in the right place, they become right. If the communication it become in the wrong place, they become worse. So this is how they have been chased out from the house, and they become so many disasters coming in. Okay, so it's very, very important. People are isolated, all these kind of people. If you find that this kind of people, when you start to communicate them, the brain will start to work, and we can bring them back from the problem actually. Okay, the next one, what prescription for people who are compulsive liars? Huh? Okay, this liars is actually attitude. So there's no medication you want to give for these liars, you know. They must change. Okay, they must change. Okay, one thing you must understand, if they want to lie to somebody, okay, when they are afraid to talk to certain people, okay, when they are afraid to talk, they will lie. Means that there is a barrier between A and B. When there's a barrier between A and B, they start to lie. Okay, but if they don't have a barrier, they won't lie. Lying like simply joking is different. Lying for a lot of things. They don't want to share the thoughts and the feelings to somebody. Okay, so this is a big problem. Why? Because there's a communication breakdown between certain A and B people. Okay, then they start to lie. Okay, there's no medication on this part. You can give some supplement nutrition, that is normal, but you won't affect on this thing. These things is more to the communication issues and the positive and negative effect. They call it cause and effect. So you must have the positive effect, give and take effect. If you don't have a give and take effect, people start to do, the person start to don't want to communicate, and they will tell lie to you. Okay, especially these things will happen in the family backgrounds. A lot of people in the family, children's fathers, mothers, all these things is happening because the trust environment, the building is not strong in there. If the building is strong, then they don't have this kind of a gap between these two barriers. Okay, another one, what prescription for open wound? Open wound, you must see the wound got two types. One is open wound, one is closed wound. Sometimes you can see closed wound, but internally is open. Okay, sometimes you see open wound, okay, totally is open. So the muscles has been teared out, that is called open wound, with blisters, or with some of the bleeding, blood coming in, or with the pus, it's still open wound. Okay, it prone to, they call it prone to bacteria and infection coming in. Okay, so to open wound, you can put a RG. RG is the best source of things. But how to clean it? You can use our body form. DXN body form is very clean. You can use that DXN body form, clean it accordingly. Then after you clean the open wound, always take a clean gauze and put on top of the wound and give a pressure. When you give a pressure, little bit of water that you clean will be absorbed by the gauze. Means that the wound will be dry. Now you put the RG, wrap it. So you keep on do that, then the wound will be completely healed. The closed wound is more dangerous actually. Most of the diabetes patient, when we go hospital, they will using lot of medicine that using closed wound on top only layer close, but internally pus will stay. So after a while, that's why it come out again, it break again. But when you're using a DXN method, we heal from the internal to outer layer. But when you use the modern medication method, they start to close upper layer and make the inner layer open. So that is more dangerous. That's why after a while, the wound coming back become more worse. So they have to cut. That's why end of the day, they're losing the whole leg actually. Okay. So using the nature method is a bit delay in healing the wound, but completely it will heal. But if you use the hospital method, sometimes the wound will heal, but inside is not healed. Okay, so there's a two type of things. You can use the RG, but for eating, you can give RG, GL. Normally, if an open wound, I don't prescribe RG. Give more GL, codipine, more enzyme, spirulina, all these enzymes, nutritions to make the blood flow is very good and faster healing. Okay, the next question, number 8. What prescription when bitten by a cobra or deadly snake? Okay, this is the external diseases. You must see, diseases are category into two categories. One is externally attack you, another one internally attack you. Holistic medicine work well with the internally attack system. Okay, not externally attack. That means you accident, you must go hospital. When the snake bite you, is external attack, you need to go hospital. Okay, because they will take the snake and the poison, then they will do something, then they will put it injection, the IV something to cleanse it out. Okay, that one hospital will take care. Okay, after they coming back, maybe then you can give some RGGL to remove a balanced poison from the body. Okay, so they don't have a long-term problem. But the first case scenario, you must bring it to hospital. That is the important part. But in the meantime, okay, in the meantime, when you go, if we awake, you can give a Androgy. Androgy is the best medicine to remove the poison from the body. At least you do something rather than nothing. Okay, rather than nothing. Okay, so Androgy, there is a book written in India, published, said for cobra, Androgy, Andrographis paniculata versus snake bites, cobra especially. So until now, the India therapists, the old therapists, still they have a Androgy juice, pure juice, they keep. So when they know somebody has been snake bites, they immediately open the bottle of the pure Androgy juice and they ask them to drink immediately. Okay, it will save their life. There is a book written and there's an evidence-based report on that portion, but don't take risk. Okay, so the first choice, you can give it before you ending to the hospital, but you must bring the patient to the hospital. Okay, and possible bring the snake also together. Okay, possible bring the snake, because you know there's so many snakes. When you bring it together, then they will take the snake venom. They can do something to find the antidote, because so many thousand snakes are in the field. Sometimes they have an antidote for A snake, not for the B snake. So that's why sometimes they will catch the snake and bring it to the thing. They said which snake they bite. These are the type of the snake. So they know the type, because you don't know what are the type. Okay. Sometimes they will once the snake bite, if you manage to get the snake, you bring. They can check with the zoologist. They will know what are the snake. So they know which are the venom is best. So it's easy for people to understand what are the venoms there. What snake, what type of venom. What is the antidote for that lah? That's why it's important. But you can't find the snake, you got no choice lah. Don't need to run and find the snake lah. Okay. Okay, the next one. What prescription when bitten by centipede? Same thing. Also the same thing. Okay, centipede actually this is the normal one now. When you go all the sawa, all these things you can get the centipede. Centipede is what you call in Malay. In Malay, what they call? Forgot already the name. Remember? Anybody remember the name?
Lipan.
Lipan. Oh, Lipan. The one is more in the what you call in Sawa there. Yes. Some area or lot, you know. So when you get the centipede is really not much poisonous rather than snake. The life longer is more longer lah. Huh? So no need to worry much. But snake, don't take a game lah. Don't play game with snake lah. Huh? So same thing, you can give Androgy, GL more. Androgy and GL will make sure the Androgy will take the poison, GL will increase the oxygen. Okay, so most of the venom will suppress the oxygen in the body. That's why the brain become dead ready. That's why people can coma when they get a snake bite or whatever. So you can give more oxygen and more Androgy to protect, but you must bring, because this is an external attack, bring them to the hospital. Then after that, follow up together with the medication or modern medication, and also with our medication also together. Okay. Number 10, when prescriptions, when accidentally fall on the butt and bang the head due to slippery surface of road. Okay, this is the bang, all these things are considered under the accident category, external attack. Okay, so you have to see how bad is the situation. If you bang your head, if you have a vomit, means that there is a bleeding in the brain area. So you must go to the hospital so they can do immediate surgery or whatever. Okay, because that can lead to a complete brain shutdown. Okay, a lot of people, when they have any accident, bang to the head, you have to see two things. One is vomit, second is giddiness. If these two things not, you feel okay, you don't have giddiness, you don't have vomit, means that you are a bit okay, but best you still go to the hospital to get the x-ray to see what's going on. Is that the head is correct, or any bleeding is still go on? So that is very, very important. Okay, so that is the part. You still can give like codipine, all these things. So immediately, because when there is a hemorrhagic, you can give a codipine, GL powder and RG. It will create a thrombosis and block the hemorrhagic. When the blood is start to hemorrhage, the brain, the vessels are break, the bleeding is started, you give more RG and GL, immediately it will stop. There will be a thrombosis happen to that area, and immediately the bleeding will stop. That's why RGGL is very good for thrombosis, to create the thrombosis. So it will block the vessels rather than breaking out and still keep on bleeding, because too much bleeding, it will impact your system. Okay, there's another question. What prescription for acute diabetes on insulin twice a day? Okay, when they take too much of insulin, actually insulin never help you at all. In reality, you see, diabetes is not a disease, it's a metabolism weakness. So you must make sure your metabolism is fine. That means your digestion system are good. If your digestive system good, your eating habit is good. You use your saliva and munch and eat. Reduce your starch level, reduce your carbohydrate level, increase your veggie, all these kind of things, fish. Okay, this kind of the natural one, certain fish you can take, no problem. So this won't increase your sugar level. So when you balance your food, automatically your sugar level will go balanced. So most of the people, I will keep on telling, don't ever go trap into insulin part. When you trap into insulin, there's a 3 category organs are fail. Your eye, leg, or your kidney. These are the failure that you're going to face it in 10, 15, 20 years in the downturn. Okay, or neuro disability. So that's why a lot of people have this kind of issues, but people keep on taking. You see, when anybody lose their leg due to diabetes, you can ask them, 99.9% cases are due to insulin. When anybody have a chronic CKD and dialysis, you can ask them, 99.9% people are from insulin. People taking medicine not. If you see in Malaysia, 1985 below, there's no dialysis center in Malaysia. Okay, the reading below 10 is normal, and somebody is reducing it and nobody care about it. The drug company keep on reducing from 10, 9, 8, 7, 6, 10, now 5.5. Okay, and what are the science behind it? Nobody knows, and nobody dare to ask it. Nobody fight for ask it. Okay, by reducing 10, before 10, there are a lot of thousands people are safe, no dialysis centers, so many thousand years. But after you reducing, the dialysis center increases, amputation increases. Okay, a lot of people are ruining their eyes, damaged eyes, glaucoma, eye pressure, cataract, all is increasing. Means that we are not going to the healing direct. We are going towards the worst direction. Okay, so you must understand where is the solution. The solution is inside you. So we balance our food, balance our exercise. Okay, we eat a proper food. By eating veggie, sugar won't go up. So nobody dies with taking a veggie. Okay, by taking rice, nobody dies, because rice actually already 5,000 more years people are eating. If the rice is a poison, I tell you, 5,000 years ago or 100 years ago, so many people already lose their hand, lose their kidney. Okay, it not happen like that. Once in a blue moon, there will be some people have. These people never have a proper diet, proper system to follow. That's why they have a problem. But nowadays, people start to follow the system, together with the medication become more worse. And when you start with one metformin, you end up in 5 years time too many medicine, because you forcing your pancreas to push the insulin. Okay, end up with so many disasters with you. And after 5 years, 10 years time, you are carrying a bag of medicine, and try to live with the medicine. You should live with the food, not with the drugs. Okay, you must know, I always remember one thing that Dr. Ranjan, our heart specialist, tell: we are prescribing drugs and poison to the patient. This is his quote, always he tell. So only use it wisely whenever it necessary only, not simply because of doctors prescribe to you and you just close your eye and take like your peanuts. Okay, don't do that. Okay, you must think 10 times before you take a single drugs. Okay, then, because it will end up with disaster, and you don't solve your problem, you are increasing your problem. Okay, try to find the more solutions. There's a lot of solution, not only holistic, in other way also there's a lot of solutions. You can go and find out it. Okay, so that is a part of the thing. For diabetes, you can use the Hong tea Richelium mix, is very good. Most of my patients that take insulin, I always advise them, okay, night after you take Hong tea Codipine Richelium mix, okay, after take 1 glass of Richelium Codipine Hong tea mix, okay, you drink a glass, half glass you drink first. After 30 minutes before you sleep, you take half glass of water, you peel 4 to 5 capsules of Androgy. Put inside your water, shake it and drink. It's bitter, but it's a helper. Okay, so you can avoid your insulin. Morning when you wake up, your sugar level are balanced. So in a longer run, you can slowly cut down your insulin. Okay, don't kill yourself by poking yourself. I see what kind of science behind it every day, poking yourself. Any science behind it? I don't know. I don't see any science behind it. Science supposed to help us, not to poke our own nose. This is not the right way. Okay, what we do, science is to help people, not to damage people. But currently, science is doing to damage ourselves, because in the name of commercialization, in the name of levels of companies are making tons of money by killing people, but not healing people. Okay, recently I sent one what do you call I share in the group, I think you all see. Okay, that is from the healthcare group. So how much in 2024 the drug companies are trying to make it? It's all $1 billion. Okay, if they really want to help people, if they really find the cure for the people, if the drugs really help the people, their sales not increase, their sales will go down. Because you are helping people, that means your sales will go down. Okay, it's not increasing every year. tremendously 100 to 200 times. Some company making 600% profit. But end up, everybody jadi orang gila lah. Okay, everybody jadi orang gila, taking nuts of dozens of the drugs into your body. Okay, with no business. Okay, so that is going on all the questions. So we talk about a little bit on the stroke. We go on with the stroke first. Okay, the main reality of the stroke. Okay, the main reality of the stroke. Why people get stroke? Okay, not simply people get stroke. You know, you must understand that. The first things, mind. Okay, the first thing is your mind. You see, people when they get stroke, you go to their house, you sit down with them, and ask maybe if husband kena, the wife, you ask the wife, what is the behavior and characteristic of this person? I done this research quite a lot. You know, so many people when the patients came and see me, first question I ask his wife, how is characteristic? How many hours he sleep every day? Okay, the time frame of his sleep is very, very low. Second, okay, how is tension every day? This person is highly tension, okay, and highly anger, everything angry, everything tension. Throughout the day, tension and anger, nothing else. You want to see the smile face on this face is very, very low. Okay, maybe sometimes with friends they are very smile, but in the house they become very bad. They're very anger with the children, anger with the thing, tension, end up with the stroke. Okay, end up with the stroke. So the main reason of stroke is actually not a pressure. You must see, even though pressure is one of the criteria, but 9 out of 10 is not the pressure. It's the way, the characteristic that they are living in. They are living in. Means that when they are keep on not sleeping every day, working, okay, no time for sleep. Sleep for 2 hours, wake up and run. Doing work, tension in the phone, keep on bang these people, bang that people. Bang for the reason they might, bang for nothing. Okay, so then they think they are Superman. Cannot. You are pressurizing yourself. Too many tasks that you taking. End up you don't have enough relaxation to your brain. The pressure automatically will go increase, not in the heart, in the brain. The pressure in the brain become very high. End up some vessels are break. When some vessels are breaked, then it's a disaster of a stroke. Okay, it's a disaster of the stroke. So that's why I always tell people, those time people are very, they got a lot of works to do, but they sleep in the correct time. That's why I always say, whatever you do, by 11 o'clock is your last call. Worst case scenario, 12. Don't more than that. Okay? Okay, not more than that. Some people sleep at 1 o'clock, 5 o'clock, wake up, 3 hours sleep every day. So the system will getting worse. The blood circulation become worse. The blood production are worse. You see, one day when you don't sleep, the next day you check your pressure will be very high. Okay, then you see your hemoglobin rate, your platelet rate. One day you never sleep, you see your blood rate, your blood RBC, your hemoglobin will drop. That's why when you want to go and donate blood, they ask you how many hours you sleep. If your sleeping is not enough, they don't want your blood. If you want to donate free also, they don't want. Why? Because you don't have enough hours of sleep. This is the first criteria if you want to donate your blood. Okay, it's very important because you don't have enough platelet, enough hemoglobin in your body to take it over. It might be endangered you after we taking your blood. This is the thing. So you must be mindly, mentally, physically fit. Means that you must relax a lot. You must make sure your time frame is good. Second thing, the food. You don't eat a proper food at all. This person who has stress, lot of job to do, all these things, always miss their food and always eat in the wrong time. Okay, eat in the wrong time. means that 12 o'clock become their dinner, midnight. Somehow with the heavy food, chicken la, mutton la, at what o'clock? 12 o'clock midnight. Nasi lemak, panas with ayam goreng, finish. Then your food is not digested. It become poisonated in your stomach. That's why when you have a dinner, make sure you eat before 7. Last call is 9. 7 to 9 night is your dinner. Your breakfast 7 to 9. Your lunch is 12 to 2. Tea time 4 to 5. 7 to 9 is your dinner. A supper, a mild supper, very minimum supper, maybe around 10 o'clock, 11 o'clock, and maybe a glass of pure milk, okay, or a glass of our cereal, spirulina cereal. Just take and drink and sleep. So don't eat too much of food night time, especially night, because you won't digest it throughout the day, because you don't have a movement. When you daytime you eat, you are moving, you are digesting. But nighttime you are sleeping. You don't have any movement. You fill up the full tank night, you sleep for what? Okay, normally we fill up car full tank, night you sleep for what? No point what? Okay, morning you wake up, you fill up lah. Why you want to put full up too much? So your digestion is been screwed up. Then a lot of acidic is been formed. That's why a lot of people have a problem when they early morning. Why early morning the attack is happening? Because some of the food is not digested, become highly acidity, the gas will go up, it cannot penetrate towards the brain, it end up with the pressure. And their sleep is not enough. Okay, these are the reasons that most of the stroke has been affected, the stroke patients. Okay, so what are the immediate thing that you can give? You see, when people get stroke, their pressure is high for a while, then after that you go back to normal. Okay, this is the standard. When you go hospital, they say, oh, very high. Then they give you injection, all these things, they stabilized. You can stabilize the patient for time being, bring them to hospital. But they can't do further than that. It's only emergency medicine they can give. Monitor you for few hours. If hemorrhagic brain is keep on bleeding, they start give some medicine to stop the bleeding. Okay, but they can't do much. It's not they don't have medicine, they can't do much. So when they can't do much, they will monitor 2-3 days. After that, they give a bunch of medicine, they send back to you. They say, go back to home, come for physio, all these things. And the patient will end up like that. What are the immediate thing you can do? Okay, for this kind of patient, immediately, you can, that's why I always say, first, teach the people to have a proper sleep, proper food, proper meal, all these things. Don't tense, become very happy, relax. That is the important factor. If they don't listen, they cannot attacked by stroke. Okay, what is the immediate effect you can give? You can give Morinzi mixed with GL powder. Immediate effect. The moment they cannot, they bring to hospital, doesn't matter if they can drink, you put a straw, ask them to take. Half bottle of Morinzi, mix little bit of water, mix with half bottle of GL powder, shake it, drink. Morning half bottle Morinzi, half bottle GL powder. Evening, half bottle Morinzi, half bottle GL powder for 7 days. You can see very fast the improvement will be coming. Then, because in the hospital, you can't give lot of things. You only can give a limited amount. If somebody asks, you say these are fruit juices, doesn't matter, you just give. Okay. After they come back home, give them the vinaigrette, codipine, GL powder or Richelieu powder. Okay. Then some enzymes, Frutzim, Roselle, all these things you are giving. So immediately the brain clot will be cleansed off. Then the patient come back to normal condition. See, a lot of stroke patients are dying, when they don't have a proper monitoring system. Because the bleed is cannot stop and it will endanger the whole system. I've treated so many hundreds of patients, stroke patients, but this one immediately when they come and see me, after stroke, immediately they come and see me. Then we give a blend concoction blend, give them 2 weeks, 3 weeks, they can come back now with their normal, they can walk, they can hand the race end. That's why you don't delay in this matter. The more you delay, the more you take time. They say 2 years, 3 years after stroke, they still cannot walk. See, if they really got medication in the system, means they can walk. Because there's no medication in the system, they only can balance and maintain the can control the pressure, they control the blood, all these kind of things, but cannot balance back the overall body system. So With holistic medication, you can balance it very fast. Okay, I've treated so many hundreds patients. I think more than 1,000 already, I think. Okay, so immediate effect is the best solution you want to give. People 2 years, 3 years, you still can give, but you can't have a perfect coming back. The body system will not perfect. They will improve, but not 100% improve. Okay, but immediate, you can give, you can see in 3 weeks to 4 weeks time, they can walk as normal. Okay, that kind of people, so many people, the facial cerebral stroke for the face stroke. Okay, this is all no medicine. The moment you go hospital, they give you steroids, they give you painkillers, they give you blood thinning agent, aspirin, then ask you to go back. They can't do anything. That's the only medication system they have. Then they say, go and see neuro. You see neuro, so they want to give the same thing. You give the neuro specialist, they give you neurobion. This is the only they can give. Some vitamins to you. Nothing else they can do. Not much medication are available for this kind of a chronic system, chronic issues. Okay. So any questions on the, what do you call, on the stroke? Any question? You can on the thing and you can ask.
Dr. Siva, what about putting the Gano oil? Apply Gano oil also?
Yeah, that is the additional part lah. Okay, the main core, when you give the main core, the small portion, you just massage, enhance the blood circulation using Gano oil. That is standard lah. You can give, no issue actually. Okay, that is the external part. What I'm focusing more is the actually internal part. Internal part is very, very important. So we give more to the blood system to make the blood system can go through fast. Okay, good. So here some questions. Let me see. What the question? Oh yeah.
Hello, Dr. Siva.
Yeah.
Dr. Siva, Amadif here, Dr. Siva. Yeah, Dr. Siva, for some patients who have stroke and they can't move their whole body, and also they can't feed from themselves by using their mouth, they have a tube to their throat.
Okay.
For them, can I give GL powder in their tongue to initiate the movement of their body?
Can actually, if they can take something from the mouth, you can balance to the mouth. But mostly we will using the tongue therapy. They call it tongue therapy for the coma patients.
So
tongue therapy, more to the, you can give it to the, you can put it little bit to the mouth. If you're able to eat little bit should be okay. But most of the coma patient that they don't realize, they don't know what is happening. So yes, we always have few concoction we put into their nose feeding. After that, we take like few drops of this concoction, codipine, Morinzi, GL powder or Richelieu powder concoction. We give a drops to the mouth because we cannot give too much, but we can give a drop. This is to activate the tongue to activate the system into directly. So then the patient will be faster wake up, because that's why I treated so many coma patient, 6 months, 1 year coma, all these things. I wake up now is a perfect people. This one all no treatment at all. The coma patients all until now there's no treatment at all. When coma they said okay lah, when you wake up lah. But you using a holistic medicine or 2 weeks, 3 weeks you can wake them up lah. No issue lah. I've done so many cases lah. The one nothing lah. Okay. So okay. So these are things, and I see there's a question here. I have pain at the outer side, Audrey. Some pain on that side of the head. I have put Gano oil, the eye alternate night. How often can I use the oil? It is most painful. We focus on reading, especially on handphone. Okay. You see, handphone a small wording. Yeah? When you focus too much, sure you got the pain lah. It's the standard pain lah. Okay, you can put the Gano oil anytime, any day, no issue. It's a very natural oil. Every day, night also you can give a drop. You can massage your eye. It actually releases the pressure in the eye actually. At the same time, you also help some cataract, small minor cataract. It will cleanse off the cataract. Okay. The utilization of the oil, Gano oil is no need to worry. You can use it anytime, anywhere. You can use it here. You can use it for your nose. You can use it for your what you call for your mouth ulcer. You can use it for the ear, eye, for air. Let's say you have a lot of air drops. You can use the Gano oil massage. You can use it. Then you can see your hair drop will be reduced. Okay. At the same time, you need to take more spirulina to make sure your nutrition for the hair is been covered. Okay. Spirulina actually very good for hair dropping, because hair dropping mostly is because of your no certain nutrition available in your blood. So when you take spirulina, you will balance your things. So when you take little bits, maybe you try 10, still dropping, you increase to 15, still dropping, you increase to 20, then you go up slowly until certain stage it will stop dropping. Then you maintain few days, then you come reduce back to your spirulina, come back until certain time, then your hair will be strong enough already. Okay, so Gano oil is good for the oil, good for the hair, and the spirulina is a very good nutrition for the hair dropping. Okay, the next one, Cheryl asked what to give someone male 60 who has been coughing for a while and been nebulizer for a few times. Today admitted to the hospital. Okay, when they are using nebulizer means their coughing means there's a lack of oxygen. That means lack of air entering the lungs. So when there is a lack of oxygen or air entering the lung, means that the body not enough oxygen. So when we use nebulizer, you're forcing the air towards the lungs. You're forcing it. At least it can penetrate through the body, can absorb some oxygen from there. That's utilization of the nebulizer. But when you do that, you will feel a bit better, but not for the long term. In the long term, it's not good. So if coughing too much, you have to see what kind of flame that blocking the thing. You must see what are the blockages in the lungs, either tumor or either flame, either some mucus. You have to see what of that. So the best, what you can do, you can mix up with the lignosus syrup. We have a lignosus cough syrup. You take 10 ml, half scoop of GL powder, mix it with 20 to 30 ml warm water, hot warm water, not too hot, but warm a bit. Okay, hot water that warming around 5 minutes. Hot water that you warm for 5 minutes, then you will have a certain heat. You mix this 10 ml of cough medicine, then you mix half scoop of a GL powder, shake it, then slowly drink sip by sip. Repeat every 3 hours. Okay, when you keep on repeating every 3 hours, slowly the flame all will diluted. And you can see something will come out from your nose area. When your nose area, they keep on some mucus come out, that means it's the thing is start to coming out. Then try to remove the thing using tissue, whatever, start to remove, then you can feel it better. And the next day, you can add in some vitamin C to balance the mucus layer also, the mucus in the lungs creation. So vitamin C can stop the mucus hyperactive. The mucus, the cells, the mucus releasing cells, you need vitamin C to stop it. So when you suck few vitamin C or you take the roselle juice, drink in a hot water, it will stop the mucus. Then you don't have the running nose anymore. Okay, the next one, I have used Gano oil on the hair drop less than 2 weeks use. What to give female 74 with blood in stool? So I have used Gano oil on the hair drop is less after 2 weeks use. Okay lah. Okay. What to give female 74 with blood in stool? Ask to stop aspirin. What she take in the place of aspirin? What she can take? Okay. You see, aspirin is a blood thinning agent. Okay. When you take too much of aspirin, it will thin up your blood vessels. You must remember that. It's not only thinning your blood, it also thin up your blood vessels. In the longer run, lot of blood vessels, small vessels will start to break. This is the one of the side effect of the aspirin. Okay, but there's no choice, but doctors always prescribe aspirin to you all. If you go higher a bit, it's a warfarin. If you go higher a bit, heparin. Heparin normally they use in the emergency medicine, but when you go down, they give you warfarin, so worst case scenario. Okay, so To balance it back, you can give, if the blood in the stool means there's a wound or ulcer in the large intestine. That's why you have a blood in a large intestine going out the stool. So what you can give lion's mane mixed with the GL powder. Okay, you can give virgin coconut oil. You can give lot of enzymes, more enzymes, fruit zymes, codipine. This is all good. And you also can give mycoveggie. Once wounds in the large intestine healed, then you can feel better lah. Then slowly the what you call the blood in the stool will stop lah. Then the bleeding is stop. Okay, and you must give vitamin C also. When there is a blood in the stool, means that the hemoglobin, the blood count in the body will start to drop. You know, sometimes people not realize, suddenly see the hemoglobin level is only 7. So then they need to pump in one pint of blood. So without our notice. That's why when there is things, you start with the roselle together, then you can see the blood level, even though it go out, the blood keep on going up. So it never reduce too low to the border. Okay, to the borderline. Okay, that's the part. Then any questions, anything? We can move on with the last chapter about little bit about the cancer.
Doc, there are some more questions on top, Doc. You have to scroll up the chat. Yeah.
Okay, let me see. Oh yeah, wait. Headache one, we already will one get headache when you are exposed to radiation. My sister nurse with the radiology department. Okay, you see, when you go radio, you will see the game plan, is it? Okay, one day you want to go radio, they give you the shirt, they wear you, ask you to that, they will protect certain area. Okay, just think about it. If the person work in the radiology department, by hook or crook, surely they will expose every day in the radiation scenarios. Even though they protect in the room, all these things, the percentage of radiation still they have to bear it, no choice. So damages of cells is keep on happening. The system damages is keep on happening. You can't stop that. This person, the best is you make sure they're taking the RGGL every day. Safe side, take RGGL every day. Any cells that damage, immediately remove, rebuild back. So that is the best way. So you take more and also give more enzyme to them. More enzyme, roselle, vitamin C for the blood, and the codifan for the neuro. These 3 things is very important. Okay, to make sure the nerve system not damaged. Otherwise, the long run, their neural system will be affected. Okay, so that's the thing. So the G8 acute diabetes, the one I think already, big toe already turned blush into 4 years insulin. This is the standard that I told you. When they take so much of insulin, so when you see the hospital keep on pumping the insulin. But when certain damages happen, suddenly they drop all the insulin. This is usual, ma. So until they find the problem, then they reduce insulin. It's too late. You should reduce it earlier stage before the problem attack the system. Okay. So went to laser surgery and what to okay. Vision blur now, want to let, okay. These kind of things, she was in the quite bad situation. Okay, you must balance the blood circulation, you must balance the nephritic system. In the next base is their kidney problem. The next, she is going to the kidney damages. Okay, and when this their eye vision gone, that means the blood supply to the vessels are damaging. Okay, so you can give basically you can give Richelium powder, or you can go give them the Mycovita, the best lah. If too much of problem complication, you give Mycovita, but you divide the Mycovita sachet into 3 portion, mix with codipine 10 ml, morinzyme 10 ml, lion's mane 10 ml. Up quarter, so 1/4 of Mycovita sachet, codipine 10 ml, morinzyme 10 ml, this lion's mane half scoop. Mix all together, blend in a glass, take 3 times. Okay, for at least 1 to 2 months or 3 months. Keep on giving. Let all the system change back to normal. After that, then you can reduce it to the normal dosage. In 3 months time, you can reverse back, all a system become normal back. Okay. Okay, the next, how to balance out chronic hormone imbalance with puberty, period abnormality, imbalance, estrogen. Okay, all these things are under the hormonal imbalanced. First thing, cut down all the chicken, a market chicken. Don't ever give any chicken to these young ladies, teenage girls, okay, children, kids, female kids that nearby to the puberty, okay, 13, 14, 15, don't ever give chicken. Stop the chicken. Then you can see a lot of changes automatically will balanced. Okay, so give them RGGL. Morinzi is a must given to these people. RGGL, Morinzi, then you can add up with spirulina, enough for them ready. This is balanced for the teenagers, enough. Then they are everything will go back to the normal condition. It takes 3 to 6 months. Sometimes it takes almost 1 year to recycle back all the system back to normal. Okay, others I think already run ready. Okay. Okay, I think Serena, this part clear already. There are any other things? I think no more already. Okay, done ready. Okay, regarding if no more question, I can go through a little bit on this cancer. Okay, we must remember one thing, that everyone in this world born with cancer cell. You must remember that nobody escaped from cancer cell. When we born, 5% to 10%, 5 to 10% cancer cells, okay, are originated naturally. Not 10 la, normally 5 la, okay, normally 5. That's why every time when you do a blood test, you can see the cancer marker reading there, you know. Means that your every markers is there. But why the markers is not go up? Because the markers has been controlled by immune system. Okay, controlled by immune system. From the day one you're born, your immune system playing a role to balance and control every particular of the what do you call cancer cells. Okay, to help to make sure the cancer cells not awaken. Okay, so when these cancer cells actually in reality, you see these cancer cells are also macro cells, macrophage cells that can fight the disasters in our body. It also help to fight the intruders or invaders or pathogen in our body. Okay, this cancer cell actually are helping us, you know. But what happened when we don't have enough dieting? We eat too much. We don't eat a proper food. We start to eating too much of toxin. When toxins start to accumulate too much in our body, then these cancer cells cannot be activated anymore. And this will attack you again against the toxin, and it become more dirtier and become more worse and start to try to control the toxin. The cancer cell try to control the toxin. For example, how it works. When the toxin are keep on going higher and higher, okay, our body try to clean it every day. Okay, when you start to clean it every day, until one time it become tired. When it become tired, what will do? It try to take it and keep in one place. Okay, like in your house, you got too many of boxes. You don't want to throw. You start to keep one boxes in your storeroom. Then the next one come, you put. And one time your storeroom full ready. Okay, now you want to clean it, you have to remove it everything. Okay, if you remove everything, your hall full with the box. What are you going to do? Okay, you can burn it or you can do anything else. So that is called toxin accumulated. Or you are cleaning your house every day and you don't know how to throw the rubbish out, so you put under the carpet. Every day look clean, but the what do you call the toxic, the dust, you are keep on sweeping under the carpet. One day your carpet become like a what do you call, like a big, small curve ready. Something is wrong. Underneath is too much. So this is how bodies start to keep the toxin. But until certain time, because of too much of the accumulated, and you never help it to throw it out. Because never help to throw it out, it become a disaster. Why? If it happened in the colon, it become one tumor that block the passage of your colon. So it become colon tumor. Okay, if it start to accumulate in your brain, okay, it become a brain tumor. So this is a tumor developing phase. Why? From the first phase, you don't remove it from your body, and you keep on putting the toxin in, and never think about how to remove it from the body. Okay, this is the second level. So when this tumor start to think, the tumor start to break. Why it want to break? The body system want to remove it from the body, and you start to break it. Okay, with the pus, all this thing. Okay, same tumor, it happened on top of your skin, on your body. Okay, let's say some tumor happened in your hand. Sometimes when it become yellowish, it become blue, reddish, then you try to cut, you remove it. Okay, then you can heal it because it's outside. But in the same thing happen internally, you don't know what to do because you can't have a proper cleaning and hygienic session to that particular tumor. Outside, you can easily clean it. You can put a medicine. But when it happened to the colon, in the liver, in somewhere else, you can't do it. Then you need the help of the oncologist. They will tell you it is a cancer. Any tumor, they straight away put under the cancer first. But they don't play a role to clean that tumor from the body. What they know, to remove it, cut and throw. But they forgot. When you cut and throw, you not clean everything. Okay, you not clean everything. Okay, so let's say you only cut the carpet on that particular area, but you must see the dust is already spread under all over the carpet, not at the particular area. So when you cut that portion you throw, the particular area also will increase because you keep on putting it under the carpet. So the another place will be grow up again. Same thing, you clean it, you cut, throw. Some another place coming because the same process you keep on doing. You don't change the process. Unless you bring the vacuum, you vacuum it up, it's different case. You completely clean. Detoxification. To clean everything. You throw the carpet, you clean everything, then everything is clean up. But you never do that. That's how holistic coming into the place. When we putting RGGL or holistic way we coming in, we help the body to give certain weapon to clean the toxin out from the body. That means the body might don't have vacuum, they don't have broom. Okay, by giving RGGL, all these things, they give you vacuum, they giving thing, they giving you some sanitizer, everything. Now the immune system have all the item and know how to clean it from the body. Not RGGL clean it, you must understand that. RGGL is a weapon to the immune system to make sure immune system have all the items they need to clean the body efficiently. When I ask you to clean your house, I don't give you anything. Okay, you only have 2 hands to clean it. You don't have sanitizer, you don't have broom, you don't have vacuum, you don't have anything. Can you clean the house? You can clean, but not effectively. But when I give you all the tools with you, broom, all these things, sanitizer, bleach, everything I give you, complete, I pass it to you. Then you got all the things. Now using the 2 hands, you can clean it, everything. Little bit by little bit. In 5 days, 10 days, 20 days, your house become very clean. That is how nature medicine, holistic medicine help to remove the toxin from the body. You must understand that. Okay, when there is a pain, you must understand that is a symptom. Okay, every chronic diseases, every cancer cells activated, every pain that you created, you detected, is actually an alarm to tell your brain, to tell your body something is go wrong on this position, on this area, that you need to look at it seriously. But what they do, okay, is for example, like you drive a car, okay, suddenly the brake light is flashed. You say, why lah, this brake light, stupid brake light lah, I want to remove it lah. Everything is annoying my eyes. So you go to the mechanic, you ask, hey, remove that brake light. Okay, what will end up? You will end up in disaster, because that is indicated the car is talking to you by sending a signal of the brake lights that the brake portion is getting worse. So when you don't clear it, the problem in the core area, okay, you remove the symptom, end up the accident lah, because the brake will jam. Okay, this is the disaster that you are bringing in all the while you go. Okay, cancer is not a disease at all, because everybody born with the cancer cell. What we do, we try to kill the cancer cell. That is the wrong approach that current medication world are doing. You cannot kill the cancer cell. The moment you born, you got cancer cell. Can you kill all the cancer cell? You have to kill the, when you born, you have to kill you. Then only the cancer cell will die. Because you die, the cancer cell die. If you don't die, the cancer cell don't die. So it activated based on the toxication level. So you need to remove the toxin, balance the body, let the body fight the disease. Okay, and doesn't matter worried about this, what you call, a lot of people think about, oh, my CA markers go up, my this one go up. Don't worry on that. You just worry about your cleaning process. Keep on cleaning. Don't worry, one day it become clean. Okay, so many people will in the mind, some patients come and see me. I told them, oh, my CA markers is going up. I say, what's the point? You are taking or talking about CA markers. CA markers is a report. You see, current medication world not giving medicine on you, no. They're giving medicine on the paper. You must understand that, huh? True or not? They are giving medicine based on your report. The more thicker your report, they're giving more thicker medicine. They don't base on you. They don't see you at all. They don't talk to you at all. They talk to the paper and giving you medicine. That is the reality is happening nowadays. You go hospital paying so much, MRI, CT scan, everything. Oh, my tumor is this big. What is so proud of this tumor is so big? The whole oncology department cannot do anything. So when they can't do anything, they talk about, oh, I already found out 5 cm tumor in your brain. What is going to cost you? 100,000 to remove it? End up you coma? It's no point. If you remove it, you only can remove it, the tumor part. But you don't remove it the all over. If you want to remove all over, I need to remove the whole brain. Okay, removing the whole brain, removing a partial brain is two things, same thing only, not much different. Whether you go coma is okay, but they won't make you die. Okay, what's the difference between coma and dying? I think better person died better lah, rather than they coma, because they will disturb everybody. They will make the whole family screwed up, and they also don't know anything what is going on. End up with the life, but no system is working. So many things they don't see in a clear picture, the clear real picture. They only see in the paper. That's why I always say, treatment nowadays is based on the report, based on the paper, not based on you. Holistic medicine, we don't care the paper. We base on you. We talk to you. You see your system. You balance your system. You naturalize your system. Connect yourself to the nature. Okay. Nowadays, people never connect to the nature. Then what will happen is end up with disaster. You see, they will always come back in a good shape. Suddenly, they got appointment in the hospital. Go back to the hospital, they stuck there, they die. You know, yesterday one case I told you, the patient actually is a breast cancer, spread to liver, spread to lung. Okay, so they call me. I said because they are very weak. After that, I give them the cordyceps powder, GL powder, more enzyme. Done. So the hospital already discharged her, huh? The hospital, PPM, PJ, discharged. Say cannot do anything. Okay, cannot do anything, but they give you the next appointment date. Whether you are live, you come lah. If not live, don't come. Okay, they know. They already said that the girl's mother only can live for certain days, 1 week only. What happened? After they come back, worst case scenario, they come back, they ask me, then I said, okay, bye. I just courier them because MCO, you cannot go and see them. I just courier them. She reversed, she become better. She can eat, appetite, everything become better. Then appointment date come. So the girl called me. I said, they already told that she will not, they can't help anything. And what's the point you going there again for appointment? No point. Okay. But what they do, they never listen. They bring. When to go to the hospital, then they see the patient. This doctor said, oh, your mother still got this to do. We want to analyze this furthermore. They admit her. When they admit her, they can walk, she can eat, she can do. So first day, okay. They put some drip, they do know what medicine they give. Second day, she cannot talk. She go weak suddenly. Third day, pass away. Then the daughter called. Actually, the daughter is a nurse, staff nurse. She called me on the before when she was coma ready. Then I asked her what they give. They're giving all the opioid drugs. I said she is okay. Why they giving the opioid drugs? Then her herself said, I also don't know, doctor. They putting morphine. She said pain, but not heavy pain. But why they put the morphine? Why they give certain medicine? All these things until now is non-crazy. And today morning she passed away. Oh, we don't know. I think if she never go to the appointment, she is still alive until today. I don't know what's going on. What is happening? I don't know. Either trial in error or something else. You see, when the patient is been discharged, no need to give appointment. I don't know why they give appointment again. They discharged if in a good condition. They discharged in a bad shape. They said she will only live 1 week. They no need to give appointment, but they still give the appointment, ask her to come back. Maybe they want to reveal back. Same thing, Pavisha, your uncle in Australia. I think Pavisha, later she can share her case. Same thing. Recovered patient has been called for treatment again. Don't know what's happening. Something is going wrong. That's why every time we need to find what is going on. We need to talk to our body, not talk to the paper. Paper can tell 1,000 things. Okay, but your body is the real core. Your life is not in the paper. Your life in your body. You must trust your body to make sure that you can heal. First, you must remember, I can heal, I can walk, I can sleep well, I can exercise, I can eat well. Then you will get all the whatever necessary wishes you want. That is the core of life. Okay, so cancer is actually nothing. Okay, it bond together with us. We are living together with that. Okay, so don't worry about that. Something go wrong, try to find the solution. Change your habit, change your life cycles. You can ask anybody. There are a lot of people can advise you. If you go any naturopath, also they can give you a good, not homeopathy, Ayurveda. They go there, they already turn you somewhere already. Okay, but naturopath, what I said, naturopathy more to holistic. Okay, they will give you a correct guidance. You change the way of your life, automatically your system come back to normal. See, Teresa immediately do the exercise ready. Okay, so okay, so this is the way of life. So it doesn't matter what kind of cancer. The moment we disturb the cancer cell, it starts to become more aggressive. Remember that. Today I sent one research paper. Biopsy is another killer. Okay, that's a real report from oncology department in US, So when you read through that paper, you will cry. Why? So many thousands of people, the way of biopsy, 99.9% become a disaster for them again. Metastasis happen because you go and when you put the needle and poke the cell, you are breaking the DNA of the tumor cells. Means that you are breaking the core. When you're breaking the core, it starts to spread all over the body. Okay, that's why the biopsy is very, very dangerous. If you don't do biopsy, I think they will die maybe another 10, 15 years. If you do biopsy, I don't know when is the lifetime. I think our cases also have some cases. I say don't, they go. I think Selena has, we know some cases. I already say don't, they go. Then now we can't say help anything really. You must know, we are not a God to do Zumba, everything change. Okay, we can guide them in a proper way, in the holistic way to help them save their life. That's the part. But listening and not listening is an individual, every individual property. It's a property for them, you know. So if they listen, they follow up, maybe we can have, maybe we will die, but not very early. Maybe we can save for another 10 years, maybe 5 years. I have treated so many last stages patient. I can make them live another 3 years with the family, with happily, you know, with happily, not with the disasterly, happily. So the family also happy, they live and they die. So the tumor is suppressed, lung tumor. I got one patient's lung tumor. The hospital said only 1 week, 2 weeks, the father died. But after they taking holistic medicine, 3 years the father lived in a good condition. Okay, 3 years. Then they pass away. Then the whole son, actually some of their son, all doctors. First they don't believe. When they come and see me, I say, you believe or not, if you don't believe me, the papers are inside. You can read all the journal report, research papers, international publications. You can read that. Then they go back, do the research, they come back again. Then they take trustfully. So they save the world. They only ask me, doctor, I only want my father live at least 1 year with me. At last they live 3 years. Until now, the whole family is the extent trust. They have introduced so many fellows. The daughter-in-law is a doctor. The son is doctor. Some working in the guy is working in Asia head, very close with Tony, you know. So with top level position, the guy, the son, one of his son. So they are still happy. Every month they just buy 2,000, 3,000 ringgit for the whole family for the baby. And one of the baby, the guy's baby, the one I tell you, the dengue one, droplet down. Remember the Columbia Hospital? I think I will share a few times on that case. One of the first, the Asia guy's daughter, when this guy was husband, the husband is in the hospital. The daughter, the wife is a doctor in Columbia Hospital. So the girl got dengue. The platelet dropped up to 5,000. So all the doctors in Columbia, especially, they said cannot help. Ask everybody to come visit your child. We can't help. We have no idea to help your child. So on that day, they call me in 11 o'clock midnight, you know. So they called, the daughter called, the mother called me. So I said, where's the guy? He said he was in India, stuck in India, cannot come back. Okay. Then on that 11 o'clock midnight, I and my wife went to Columbia Saramban, passed the Roselle and GL powder on that night. I said, take little bit, mix with the spoon, give into her mouth, little bit by little bit. The next day morning, the platelet go up to 8,000. Then I said, continue giving every hour. Don't stop. Keep on giving. They keep on giving. And now the kids already 6 years already safe. Otherwise, close chapter. You see, simple disease also we cannot treat it. I don't say modern medicine is not good. Modern medicine good. We have to see where to put it in for the chronic cases. Painkillers we can get, but not too much. Certain emergency, as I told you, external attacks. They mean accident, like snake bites, all these kind of things. Hot water suddenly drop in your fire in your body is activated. That is all you need, emergency medicine. That you need to go to the hospital. But chronic, what I mean is chronic. When it comes to chronic cases, we need to fine tune the medication. We balance with the nature medicine, nutritionized system, then balance back the system. Okay. So cancer cells is always like that. We have to see how bad is the thing. Even sometimes some patient very critical already. They already go beyond the helping count. They come and see us in the last stage. When anytime they come to the last stage, the chances to recovering is not easy, you know. Okay, but You must remember one thing. The last stage they hope on us, They already spend under 1,000 everything, but they don't ask the doctor to hope. They ask us to make a hope. So we are not a God to give them a hope. We said we will try our best to balance it. In that scenario, so many patients are coming back. But you see, it's not a balanced time. If they come earlier stage, maybe we can give a full balancing. But when it comes to last stages, sometimes we can't help them. It's very pity. Last time cannot help them. Okay. So many thing is going on the cancer side actually. So I see, don't ever afraid of the cancer. When you afraid, that is a disaster that you're going to do. The more fear you are, the more fear the cancer cells become spread. The more faster it spread. Become motivated. The cancer patient need more motivation. Okay, rather than the chemo and radiation. The chemo and radiation is not. But some scenario, some certain case-based scenarios, sometimes chemo can give, but it case-based scenarios, not to all. Okay, but what happened? They don't give the chemo and hold it. They give the chemo, keep on giving. That's why the people become died. If they keep on giving, okay, chemo, maybe they wait for 3 months. They monitor closely. If the every system going back to normal, the tumor not growing up, then they can stop the chemo. They only can start with only one chemo, because always remember, first chemo will always work fine. Second chemo will against. Third chemo totally against. That's why they always say chemo not working. Okay, when I give you a poison first time, you will survive. But second time I give you, I'm sure you will die. Okay, this is how body will react. Okay, so first chemo, because body is clean, not much toxin. So you are putting first toxin. So everything will be shrinked. All the tumor, everything becomes shrinked. So the doctor say, oh, very good. That's why chemo is playing a game in the first chemo. The result all become good. Then they say, oh, you're recovering. They give you good hope, all these things. But end up it come back. This is the case-based scenarios happen to each and everyone in this world. First chemo always good. The last chemo always the bad. Then they top up chemo. Okay, when they top up a second chemo, they already start to see whether you live or die. It's a test case based already. Whether you will live lah. If you die lah. They don't care because you sign everything. I am pleased myself to die. You signature it. So don't care lah. Who want to care when you signature it that you give yourself to die? Okay. If really this thing is not poison, why they want to take all the signature from you? Like you are willing to die. End of the day, nobody can sue anybody because you are willing to die. Not they are. They're not killing. End of the day, they're not killing you. You're killing yourself. Okay. So many things you need to see and study it before we go and stuck into the system. Okay. So I think this part little bit, you got some ideas what's going on. So balance it. No need to go and check all these things. Sometimes people think by taking every year a blood test with this thing, with test, and I tell you 101 MRI, everything for what? What are you gonna prove? End of the day, you must think. Every day morning is a bonus for you. You still live. You can see, you can hear, you can talk, you can walk, you can laugh, you can do all your work. Means you are perfectly good. A small 0.01% that pain here, pain there. That is only a 0.1% from the 99.9% from your system. Don't worry about 0.1. Okay? Only worry about 99.9% because all the criteria for human being, everything is fine for you. So why are you worried about? See, a lot of patients say, they got breast cancer. That is only 1% from the 99. The 99% is still working fine. Why are you worried about 1%? End up the 1% killing the 99%. Okay, so don't do that. Clear your mind. Fight your system. Always think that your system is the best system in the world. Your immune system is the best doctor in the world. Nobody can fight or change your immune system rather than you, or rather than you accept to somebody giving something to you. Okay, and we are willingly giving a chemo to the body that can be healed by itself, but you willingly giving the poison to the body. This is actually disastrous. That until now, none of the medication system has been changed. Even though they see failure is higher than the recovery. They know the report, the statistic, everything you can see, the chemo failure is higher than the recovery. But the system is being changed? No. Why? Because a big commercialized environment. So you can't change the big environment. So you only can change yourself, become more healthy. That is only the way we live. Okay? So good. Any other questions? You're almost 10 o'clock already, yeah? Very fast. Any questions?
One question in the chat, Doc. On Gano oil application on a lump.
Okay. So the Gano oil, actually, if you found any small lump, the lump can cause by so many factors. Must understand that. Sometimes a mother, last time they're breastfeeding the kids. After that, they stop breastfeeding. After so long, they will see some of the milk duct has been filled, not released. So this milk duct will be storage and become a lump. So, okay, it's a milk duct storage. If you don't find any discharges, anything, something like a funny thing going on the breast area, all this thing, you don't need to worry. Okay, use the Gano oil, apply clockwise. Apply clockwise. When you start to do apply clockwise, you are enhancing the blood circulation throughout the breast area and also the lymph node. So the lymph node helping to collect all the rubbish from the breast area towards your lymph nodes to the liver and return back to your toilet. Okay, this is how cleansing process happening. So do that. So if you feel something small swollen, just massage it according to clockwise. Don't against the clockwise. Our body running in a clockwise mode. Okay, follow the blood flow. Don't against the blood flow. Okay, so that oil is actually very good. Okay, if you find something unusual, don't worry. Don't immediately do biopsy, all this kind of thing. If you need to monitor it, you need to monitor it every day. Okay, if it not grow, don't worry, it's a benign. If it grow, become something, then find the solution to stop the growth. When growth is stopped, you don't need to worry already. The body is already taken over already. When the body immune system take over, you don't need to worry already. You don't worry about anything. Okay? Clear?
Yeah. Any more question? Last question? No more question? Clock running, 10 o'clock, we must close. Go to sleep. Doc, you have a patient here in Kuching who has rectum cancer, 3 nodules. And after a year of treatment, clean bill of health. And he did not know that he has the cancer pile in his rectum. That was a accidental discovery. And he diligently took the prescription. After a year, cleared, clean bill of health. And he's so happy. Now he's promoting DSN to all his colleagues.
Good. Actually, that's why I said you keep on eating whatever there, you just keep on. Remove the toxin, balance your body, enough. You don't need to worry about anything. When you worry, there's the problem started. Okay?
Doc, we always